I am married. I have a brother-in-law who also is married. A few years ago, his wife was expecting. When she went into labor, they reached the hospital. And the hospital people told them that we can deliver your baby normally, but you have to pay for a C-section. Otherwise, we will force you to go for a cesarean. Obviously, he paid for the C-sec and got a very beautiful baby delivered normally. Can you put yourself in the same shoe where the medical decisions of life and death are made on commerce? Unfortunately, the urban healthcare landscape is driven by money. And experts now have started saying that living in metro cities is actually a health hazard. But what about the rural healthcare scenario? What drives it? Come on, there is no driver because rural healthcare scenario is very poor. It's a struggle. An APL family is just one surgery away from becoming a BPL family. WHO norm says that for 1,000 people, there needs to be one doctor. But the reality in Indian rural areas is one doctor for 10,000 people. 2 million nurses are needed. The hospital bed capacity is below 40%. Who cares about villages? ਮੀਂਹ ਪੈਣ ਤੇ ਜਦ ਟੋਬੇ ਵਿੱਚ ਡੱਡੂ ਬੋਲਣ ਡੁੱਲਦੀਆਂ ਨਾਲੀਆਂ ਵਿੱਚ ਨੌਕਾ ਚਲਾਉਣ ਦਾ ਸਵਾਦ ਹੀ ਕੁਝ ਹੋਰ ਸੀ। ਪਿੰਡ ਦੇ ਭੰਡਾਰੇ ਦੀਆਂ ਆਲੂ ਪੂਰੀਆਂ ਖਾਣ ਦਾ ਸਵਾਦ ਹੀ ਕੁਝ ਹੋਰ ਸੀ। ਬਰਸਾਤ ਲਿਆਉਣ ਲਈ ਕੀਤੇ ਗਏ ਜੱਗਾਂ ਦੇ ਵਿੱਚ ਕੱਢੇ ਪੀਲੇ ਚੌਲਾਂ ਦਾ ਸਵਾਦ ਹੀ ਕੁਝ ਹੋਰ ਸੀ। ਚੇਤ ਦੀ ਅੱਠਿਓਂ ਨੂੰ ਮਾਂ ਦੇ ਬਣਾਏ ਹੋਏ ਕੜਾਹ ਪ੍ਰਸਾਦ ਦਾ ਸਵਾਦ ਹੀ ਕੁਝ ਹੋਰ ਸੀ। ਸਵਾਦ ਸੀ ਖੇਤ ਵਿੱਚੋਂ ਤੋੜ ਕੇ ਖਾਧੀ ਹਰ ਮੂਲੀ ਤੇ ਗਾਜਰ। ਗਰਮੀਆਂ ਵਿੱਚ ਮੋਟਰ ਤੇ ਨਹਾ ਕੇ ਅੰਗੂਰ ਖਾਣ ਦਾ ਸਵਾਦ ਹੀ ਕੁਝ ਹੋਰ ਸੀ। ਲੋਕੀ ਕਹਿੰਦੇ ਆ ਉੱਥੇ ਰੇਸਤਾਰਾਂ ਖੁੱਲ੍ਹਿਆ ਆਜੋ ਚੱਲੀਏ। ਮੈਂ ਕਹਿਣਾ ਆਜੋ ਪਿੰਡ ਚੱਲੀਏ। ਆਜੋ ਪਿੰਡ ਚੱਲੀਏ। ਆਜੋ ਪਿੰਡ ਚੱਲੀਏ। What is there in a village? Can you imagine spending millions of rupees to become a doctor and then go to a rural area to serve the patients there? The ROI is not there at all. But can we ignore our villages completely? 70% of India lives in villages. Something has to be done. That is where somebody thought of a solution. He opened India's first ever private medical college, providing MBBS studies free of charge. Out of 720 medical colleges and teaching hospital, this is the only hospital without any billing charges. I was born in Punjab. For 40 years, I stayed here. I'm a mechanical engineer by studies, wanted to be a poet, and worked with Times of India. But always was looking for something with a deeper purpose, more impactful. And when I saw this, I knew this was my calling. On the 6th day of the inauguration of this hospital, I moved myself to the headquarters with my family to serve in the mission, lock, stock, and barrel. In this hospital, we have OPD consultations, hospitalizations, medication, and even surgeries, all done free of charge. There are no billing counters. What is the impact? You may be wondering about. Till now, we have served more than 1 million patients in this hospital. We are clocking at 40,000 patients per month. Let me give you a story. We had a migrant laborer lady come to our emergency ward in the night. It seems she was expecting a child and she went into labor and she delivered a premature baby. Fortunately for her, there was a NICU ward just across the hall. Why not? Her name was Asha. For 40 days, this premature baby was kept in the NICU ward. Can you imagine a migrant laborer affording NICU charges for 40 days? As I mentioned, APL families are just one surgery bill away from becoming BPL families. But this hospital was providing everything free. After 40 days, when she is about to be discharged, she is coming out with the baby. She saw a beautiful Ganesha statue in the hospital, and she praised before the statue. May this child become a nurse in your hospital. Now everybody got curious. When you are standing before God, you are asking for your child, why not ask her to become a doctor? Why are you going for a smaller pie, right? Everybody was like curious to know, and she replied, when you save one life, you are a hero. When you save 100 lives, you are a nurse. The edifice of compassionate healthcare has started showing impact. Now everybody wants to participate in it, in whichever capacity they can do. And we know there's a lot more to be done, and we are not falling back. We are upping the ante. With this building of the hospital, we are going to make it the world's largest hospital without any billing counters. This is the layout where I stay now. But we know that this is not only the only place of rural India which needs healthcare, right? That is why we have gone on to create world's largest chain of pediatric cardiac hospital across the globe. There's a hospital in Haryana. There's a hospital in Mumbai. There's a hospital in Chhattisgarh, Naya Raipur. There's a hospital in Siddipet, Telangana. There's a hospital here, as I mentioned. There's a hospital in Fiji. There's a hospital in Sri Lanka, Nigeria, USA. And guess what? 2 small clinics here in your neighborhood, Punjab. Mallewal, very near to Nabha, and Togahedi, if you know, now Malerkotla is a district. We have 2 clinics there. How we have grown is because all of you have joined hands. Let me give you another story. There was a poor child in Karnataka, but she was good in studies. Her parents allowed her to study till 10th because government education is relatively affordable. It seems she wanted to become a doctor. But to prepare for NEET exam, you have to spend a lot of money on books, study material, extra tuition. Who will pay for that? Looking at the determination of the child, the mother of that poor family decided to sell the only piece of jewelry she possessed, her earrings. And the girl started crying, Amma, you have to sell your gold. And the mother said, no, child, you are my gold. Inspired by this, the girl cracked NEET exam. But then what? Still, college fee have to be paid, right? That is where Sri Madhusudan Sai Institute of Medical Sciences and Research came into picture. Not offering only free MBBS education, hostel, food, books, even clothes. Everything is given to these students free of charge. As I mentioned, that this is not only done by us, a lot of stakeholders have come together. To put it in again in poetry, मैं अकेला ही चला था जानिबे मंजिल मगर लोग साथ आते गए और कारवां बनता गया. This is where I invite you to join hands with us so that we can co-create compassionate healthcare and make sure that healthcare is not a privilege, it's a promise delivered to all. Let's make sure that the doctors do not look at patients as money-making machines. Thank you very much.